friendly bacteria have always been at your side, and they have always been in your gut. Okay, let's some of these good bacteria and recognize that these have been our friends, and these bacteria are now available in commercial preparations. Have been symptomatic for quite a while. That means the criminal or the bad bacteria have had their field for quite a while now. Bacterial colony counts of millions or billions. Okay, but let me tell you, 1 gram of your stool will have 10 trillion bacteria, and they have outnumbered the good friends. So if you eat 1 billion, which is like 1,000th of a trillion, so you're eating 0.1% good bacteria twice a day. You do the math. Most of the people who are listening to this podcast, they are good at math, right? That's why they are listening to this podcast. So with this, you do the math. This number is just not enough, and you will have to keep supplementing, and you will have to keep sending soldiers inside, maybe just to get overnumbered.
Welcome back, viewers. You know we love to deep dive into different aspects of gut health. So today we are going to take a look at something that is extremely important. If we think about inflammatory bowel disease, it's a disease or a very painful condition that affects about 0.3% of people globally. But if we think about the incidence that has been rising in India, what was previously thought about as a Western disease is rapidly increasing in India. India is moving towards being the capital of IBD, which is very, very scary and shocking. So in order to understand this disease a lot better, we have a very special guest with us, Dr. Akshay Kulkarni. Welcome, Dr. Akshay. So Dr. Akshay Kulkarni is a leading gastroenterologist working with Deenanath Mangeshkar Hospital in Pune. And he had his training with senior gastroenterologist Dr. Uday Ghoshal. He also worked at the Midas Hospital in Nagpur previously. He is currently working on setting up an IBD specialist clinic in Deenanath Mangeshkar Hospital. He has several publications in this field, and he has a lot of research projects that are going on. With this introduction, welcome, Dr. Akshay.
Thank you.
It's great that you have joined. And as I mentioned, we are going to talk about inflammatory bowel disease. So there's a lot of confusion between IBD, which is inflammatory bowel disease, and IBS. People get very confused and they think it might be the same. So would you like to elaborate on what are the differences in this?
So inflammatory bowel disease is the scarier form. IBS or irritable bowel syndrome. So two things are entirely different. Irritable bowel syndrome is the hyperactivity or hyperreactivity to the bowel, of the bowel to any of the noxious stimuli or even non-noxious stimuli. So the signals that the bowel generates in response to either excess gas or excess acid or even excess food, they get over interpreted, and the person feels the discomfort and maybe after evacuating stools, or maybe after burping and releasing a lot of gas, he feels better. So that's essentially a common man definition of the IBS, or rather the symptoms of IBS which are to be recognized by a non-medical person. Whereas in inflammatory bowel disease, the term itself is self-explanatory. It involves severe inflammation of any part of the bowel. So there are two types. One involves exclusively the large intestine, and that is called as ulcerative colitis, whereas the other can involve any part of the gut from the mouth to the rectum, and it is called Crohn's disease. It is more severe. But both these diseases involve active inflammation and an actual damage to the gut, in contrast to the irritable bowel syndrome, where there is no actual damage to the gut, only the neurotransmitters and the chemical digestive processes that happen within the lumen of the gut, they go wrong, and there are some uncomfortable sensations produced without an actual damage. That's irritable bowel syndrome. But in an IBD or inflammatory bowel disease, there are actual damages produced to the gut wall, and those can be as mild as just a small patch of inflammation to literally the inflammation or the disease process tearing through the gut wall to create a fistula or a perforation, which is a very severe condition and must be treated surgically. So IBD can create medical emergencies like bleeding from the gut, or bleeding through your stools, or having dark stools, which are again a sign of internal bleeding, severe abdominal pains, recurrent pains, weight loss, loose stools without blood, and actually surgical emergencies like having a perforation. So IBD is an entirely different phenotype of diseases, and definitely is much more severe and requires medical attention as well as prompt treatment right away to avoid complications. Also, IBS, with the right treatment, with the right diet, and with the right medications, can be absolutely treated. There is a common misconception that IBS, once diagnosed, will never be treated, and it's a chronic disease and kind of incurable. But there is nothing of the sort. Whereas IBD, you must treat with surgical therapies or medical therapies, and the treatment must be as long as possible to maintain a good remission and good suppression of inflammation, without which you will definitely have a relapse of the disease, unless the disease is too mild, which is in very less number of cases. So an IBD is inflammation, severe disease, must be attended straight away. IBS, medications are just a part of the disease. Diet and lifestyle modifications can work wonders with you, and it is curable. IBD, it is still treatable, but a complete cure is yet elusive.
Thank you so much that you have defined and well delineated what IBS and IBD are. And I love that you mentioned inflammation, because in IBS we see that it's mostly associated with gut dysbiosis or some infections. But IBD, when there is inflammation, it's like the immune system is in it's attacking the body itself when there's no real enemy as such. Yes, there might be some infections, but it is the immune system that's overreacting, and there's so much inflammation that is going on. So that's quite different when we compare it to IBS, as you rightly said. So when we are talking about IBD or inflammatory bowel disease, what are the common causes that you have seen? It's not a random disease, like it's not occurring randomly. So what do you think is the most common cause that you have noticed? Is it genetics? Is it diet? Is it lifestyle or environmental exposure, or a combination of everything? What is it that you see most commonly?
So IBD is a multifactorial disease. Inflammation is the downstream and the end result of an insult that has been going on for years, maybe decades. And most of the patients that present to me with final symptoms, when they actually already have had the damage, or the damage has already set in, it is actually at least a few years, or maybe at least a decade before the symptoms have started, that the disease process actually starts. The disease starts with what you mentioned as dysbiosis. That means when I'm sitting here perfectly healthy, just like yourself, across each other, we are enjoying a very nice and balanced environment within our gut, and the food that we eat gets perfectly digested. There may be some on and offs here and there, and we may have some uncomfortable sensations whenever we attack our gut with an untimely or an unnecessary overindulgence. But then other than that, our gut is still able to perfectly function, digest all the foods, give us nutrition, make us grow. But that is also, that's not the credit of our own immune system or our own gut only. There are friends who reside within us, which are called the gut microbiota or the gut bacteria. And actually, to credit the bacteria only will be kind of short-sighted, because these are whole species and whole genera of organisms, including bacteria, viruses, and even some fungi, which are our friends, and they reside within us and very well within our large intestine as well as some part of small intestines. And these help us digest some nutrients. They actually isolate some of our own nutrients from our food and give it to us as a gift, while taking a small cut for themselves and growing with us. So they are called commensals. Commensals in Latin means friends staying together. So this symbiosis, or living together, another Latin word. So the symbiosis actually is the most important factor in our gut, helping our growth through digestion of important nutrients like proteins, fats, carbohydrates, and vitamins and whatnot. So whenever this symbiosis gets disturbed, hardly any symptoms are produced, because that can be corrected by the friendly bacteria. But when the criminal or culprit bacteria, they start rising, and the diversity of all these organisms, it sorts phases into a singular dominance of criminal bacteria. So just like in a society, if the criminals rise, then there is a kind of a chaos, and all of it becomes like Gotham City in Batman. So the criminals rise and the mob will rise, and Batman alone will not be able to fight himself. So and the city falls to criminals. So that's the kind of thing that happens within our gut, and the criminals rise and they start attacking the gut, and the immune system starts responding abnormally, and there is fight within the body itself, and that causes inflammation, and that is the end result where the inflammation happens. So to answer your question in a brief short note, it is the diet, the lack of exercise, if I would say very frankly, the westernization of the diet as well as the lifestyle, and the shift away from healthy Indian food, which was rich in fiber, rich in proteins, rich in multiple vitamins, shift away from fruits and a fruit-rich diet. All of this has slowly caused an increasing incidence of IBD, and we are well on our way to become the IBD capital of the world. But I think it is all the diet and lifestyle. Genetic component in IBD is very less pronounced, at least in India. We see a very less number, or actually absolute rarity of genetically predisposed IBD cases. I have seen a few twin siblings being involved with IBD, or being having IBD, developing IBD one after the other. But other than that, genetic IBD is very rare. So while some of the genes are responsible for defective immune responses and defective immunity, but if your father has it or your mother has it, there is not a very great chance that you will have it, unless you resort to an absolute unhealthy lifestyle.
That is very interesting. Because you said it's a multifactorial disease. Thank you so much for explaining it so well. So what I have also read is that according to several publications, the genetic component has been very common in European descendants. So there are 200 different loci or genes that are associated with these diseases, IBD, Crohn's disease, and ulcerative colitis. It's very rare in India, but it takes activation with the lifestyle, with the poor diet that you just mentioned. It's not that just because it's genetic people are going to have it. Those genes also need to be activated by those poor choices that people make, and we are seeing a lot more of those poor choices even without the genetic component. That there are environmental factors, there's poor lifestyle, there is poor dietary habits and everything else. So that is leading to this rise in the cases in India. So as you mentioned, it begins with dysbiosis. That's what dysbiosis happens when there's an imbalance, when the lifestyle and the environment is not favorable for the gut microbiome. And when we are talking about the gut microbiome, as you mentioned, we know that there's an imbalance in the gut microbiome. There are beneficial bacteria, like for example Faecalibacterium protsnici, that is reduced. We require bacteria like that. So what do you see in IBD patients? Microbiome testing obviously helps give an idea about what is happening in ulcerative colitis and Crohn's disease or IBD, but what is it that you see in your clinic?
So hardly any patient actually walks into my clinic. He's already bothered with his symptoms, and maybe had suffered for at least a few months before getting diagnosed with IBD. Or since I work at a tertiary referral center, most of the patients have already been treated unsuccessfully elsewhere by physicians or surgeons or gastroenterologists, and they have been explained that some of the treatments may fail, but then further treatments will be required, and then they either get referred or they choose to come to a tertiary health center for further treatment. So across all such spectrum of patients, I hardly see anybody asking me. I hardly get a patient asking me about how to alter the gut microbiome, or how to change the gut microbiome for good or for the better, so that he or she will have a symptomatic relief. Because most of my patients, or I would say none of my patients, have the basic clue about how the bacteria were helping him or her before, when he or she was healthy, and now the bacteria of the bacterial population has changed, and they are the ones which are playing a role, if not a complete role, but at least they are contributing to the disease process. So because there is a general lack of awareness that yes, these gut microbiota are also playing at least a very important role, if not the central role, in the disease process, and that is why at plus they are being troubled. They are looking for quick relief, which happens with medications. The problem that happens with IBD, I would say, is that medications may or may not be able to stop the symptoms, bring about what we call an improvement, or the medical term is remission. So they are able to bring about a remission, and the patient is happy that he's relieved of his symptoms, and now he ends up asking, how long do I have to take this treatment for? And most commonly the answer is, you have IBD, it is not curable, and you have to take this treatment for lifelong. That may not be always true, and there have been cases, at least mild IBDs have been treated very successfully and then let off treatment, but with a disclaimer that a significant majority of them definitely relapse and come back, unless they maintain a very healthy lifestyle and watch what they are eating and watch what they are doing with their life. But yes, IBD does require a very long-term treatment. It eats away at your finances, at your time, at your maybe professional life, unless successfully treated. So speaking of treating IBD successfully, one important addition I feel would be to assess the gut microbiota of such diseased people, to see how far they are from the normal. We have to establish a standard, or at least a benchmark for the normal microbiota by assessing normal people, and then see how far the mild or the severe IBD cases are, and try to bring them as close to normal as possible with both medical interventions like IBD treatments, as well as giving some friendly bacteria as medicines. So that is possible through simplest of home remedies like curd, because curd is one of the best cultures of lactobacillus, which is one of your best friends within your tummy. So as simple as giving curd, or as simple as eating a couple of fruits daily, will improve your immunity and your bacterial population and what we call as a gut microbiome, and it goes a long way into creating a healthier environment and consistently maintaining it on a healthier side. So, but when the damage has already happened and the criminals and the bad bacteria have already taken a house and they have captured the castle, whether it is possible for these good friendly bacteria to again come back, conquer, and help us regain what was ours is kind of tough to predict. So a lot of people actually also have a misconception about avoiding all milk products when they have the diarrhea, or when they have loose motions or bleeding in stools or abdominal pain. They say it is because of acidity, it's because of gases, not realizing that they have actual IBD. Even if they have been diagnosed with IBD by a very senior gastroenterologist or a super specialist, they still have these misconceptions, and they keep being fed from all directions, because everyone is a diet expert, self-proclaimed. So that happens a lot within families, outside families, and he or she gets bombarded with a lot of dietary advices. Why are you eating this? Why are you eating that? That sort of thing. So yes, so a definitive scientific advice regarding how to change the environment, not only medications, but how to change that bacterial environment towards the healthier side by eating right is what is critical. And while a lot of patients keep repeatedly asking what to eat and what not to eat, they do not stay consistent at those attempts. That's my observation.
Thank you so much for those wonderful insights, because that's what we also commonly see, that people lack the awareness that there are bacteria, there are trillions of microbes in our gut that are our invisible organ that are helping us digest our food. If we are missing any of them, which most of us are, unfortunately, because of our poor choices of lifestyle, diet, and everything else, so we are not going to be able to digest the food that we are eating, then we are not going to get nutrition from it. This is the reason why many people cannot digest milk or dairy products or even gluten, because they just don't have the right kind of bacteria that are going to help them. It is as simple as that, nothing so complicated. So as you rightly said, that they get all of this advice from their peers or any influencers, and then they think that, oh, this is the right advice, and that is damaging people's health even more. Simple fixes like our lifestyle, our diet, and whatever takes, it's a long way in helping people recover from any chronic disease. So I mean, it's something that we have to go back to our traditional roots in order to figure out. So it was wonderful that you mentioned this.
Youngest
One
of patients,
question.
IT professionals, or especially IT professionals, people who are living outside their homes for the first time, they come not with IBD. Maybe they have IBS, maybe they don't even have IBS, let alone IBD, something severe like IBD, but they have simple digestive problems, and then they suddenly became aware that, okay, yes, I must have been eating wrong, because that is the only thing that has changed away from home. So they guess it right. They are intelligent enough to guess that it is their food and lifestyle that is causing the problems. And then they come up to me and say, okay, what to eat? So the medications are okay. They are quick relief and they are wonderful, but then what to eat? So I just tell them, just eat what you were eating at home, what your mother was feeding you, what your grandma would have fed you, home food. And if you are not at home, or if those people are not around, just try to make these things at home and try to eat those. Okay, because
Absolutely.
those people have always known what is good for your health and what is not good for your health. Maybe not through a core scientific knowledge, maybe not a complete scientific study of all those components and nutritional components of every food. They may not have the knowledge of that. Most of these mothers and grandmothers, being housewives, they may not have had the knowledge of those nutritional components back in the day, but they definitely knew what was good for your gut, what was traditionally practiced, and what you have been exposed to as a diet for maybe 30 odd years of your life. If you suddenly switch from that diet, you are bound to have problems. Okay, so that is why going back to your roots, as you mentioned, is always the solution.
Absolutely. That's the same food that helped us grow as a child, thrive, and be disease free. That's the same food that is going to keep us healthy. It was such a simple yet incredible tip that you have given. So, when we talk about simple things like this, we also need to know, when we are talking about any digestive disorders, we hear this term leaky gut. So, what is it? What for the layman audience, they would like to know, because we hear it very, very, very often.
Okay, so what happens in a normal gut is it has a wall. Okay, it's like a tube. So whatever you eat enters the tube. The wall will have digestive enzymes. The wall will have a very delicate skin, just like the inside of our mouth. It will have a delicate skin. It will secrete the digestive enzymes. Whatever you eat, the rotis, the chapatis, the rice, and the dal, the proteins, carbohydrates, they get separated from each other due to the chemical lysis of these enzymes. They are chemically broken down, and now they're ready to be absorbed through this wall. So the nutrients have to cross this wall. It's a chemical process, and these nutrients then get absorbed into the blood, and they're used for your growth. So what happens is this gut, while it allows nutrients to cross, it does not allow any kind of infections to cross. It does not allow any kind of bacteria which it recognizes as foreign to cross this barrier. So it's like a gate at the entrance of a palace or a castle, where people with maybe an ID, or people with maybe politically important people, they are allowed to pass. The gate is opened, but for other people, foreigners, people carrying weapons, there is a security, and they will hunt these people down, and they will stop them. So it's like a gate. So this is a barrier. So this barrier gets broken down. Whatever happens to this wall in case of infections or any kind of inflammation, like in IBD. In IBS, the barrier is intact. Nothing happens. But IBD is one of those diseases which produce a leaky gut. This barrier gets broken down. The guards standing at attention in this wall, your immune cells, they start getting confused. They don't know who the friend is. They don't know who the foe is. So they start letting in people or bacteria or other pathogens which actually could be harmful into the system, and they either attack the wall or they attack structures outside the wall into the system, and one of the effects is IBD. So this creates a lot of problems. The nutrients don't get fully absorbed. The nutrients get wasted in the stool. The growth gets hampered, and an adult person starts losing weight. He's not able to maintain his weight. He's not able to maintain the appetite, and then a horde of problems will begin. So leaky gut is essentially lack of your defenses and lack of your immunity at the level of the gut. So to stop that from happening, you need this guard at attention all the time. And for that to happen, you need to have the right diet and the right bacteria growing within you, and the criminal and the bad bacteria. They should be, they can be present, but they have to be inhibited at all times, and that is achieved by the good bacteria. You don't have to do anything about it. You just have to eat healthy.
Yes, so that ID that you said, as you rightly said, that ID is required for the gate to open for the nutrients, and that ID is called zonulin, which is a protein that acts as an ID which allows this entry. But if zonulin is overexpressed, or there's too much of zonulin in the gut, then the gates are always open. It's like the ID is always shown there and anybody can enter. So is that something that you test for in IBD? Is zonulin tested for?
Not routinely. So what happens is when the IBD already happens, or when the patient becomes symptomatic, all of this damage, the leaky gut and the zonulin overexpressing itself, and the bacteria overexpressing all those friendly IDs, but then they are enemies actually. So all of these bacteria have already set in a poisonous process of damaging the gut, and when the gut is finally damaged, when all of this process has happened, the downstream result is the symptoms of IBD. Yes. It is after the wall is already damaged and the gut is already damaged, it's now already bruised and not able to absorb the nutrients, not able to perform the digestion very well, and not able to provide the necessary help to the friendly bacteria. So all of those things happen maybe for a few years or even a decade or two before the actual symptoms of IBD set in. So when I see any patient who walks into my clinic either diagnosed with IBD or with symptoms of IBD, which I have to diagnose for the first time, this damage has already happened. Okay. So it's already gone way far beyond, testing for zonulin. So if I were to test for zonulin, maybe within me, you, or somebody else who is listening to this podcast, I might find a zonulin deficiency, but that's like looking for a needle in a haystack, because if I test for everyone's zonulin, everybody will have some kind of leaky gut, because not everybody is eating healthy. Okay, rather I would go out on a limb and say almost none of us are eating healthy nowadays. Okay, because healthy does not mean what you eat. It also means when you eat it, how you eat it, and what you do in between. So in addition to what you eat. So all of these things are absolutely important, and none of us is mostly because of our job compulsions or the variable time periods and the unhealthy schedule of right from the simplest things like waking up or sleeping on time. Everything is so disturbed that the diet always assumes a small part of our day, and we hardly have the time or the capacity to pay a special attention to it, whereas it actually comprises the most important part of our life, because we are able to grow normally and function normally because of the diet. But then we ignore it so much, it's almost criminal.
As scary as it sounds, I think this should be a wake-up call. If we test ourselves for zonulin, I'm sure we would test positive for some of it at least, because I mean, it's a very unhealthy lifestyle, whoever it is. But when we talk about treating IBD or any of these chronic diseases, what is your take on probiotics? Is it a game changer, or do you think they're overhyped? What is the role of probiotics in treating IBD especially?
So just to give a quick recap, probiotics are the friendly bacteria that I have been talking about.
Yes.
So when I say that you need friends, you need those guards, you need those gatekeepers which keep the bad bacteria or the criminal bacteria at bay. Don't let these criminals rise, and maintain a healthy environment within the society of the gut, and help you digest all your nutrients and make you grow from a small baby to a big person.
Yes.
These friendly bacteria have always been at your side, and they have always been in your gut. Okay, so so these people, fortunately, we have been able to isolate some of these good bacteria and recognize that these have been our friends, and these bacteria are now available in commercial preparations, and
Yes.
these are probiotics. So these come in powders, or these come in tablets, or these even come in solutions. So what happens is, if you were to give these good bacteria to a person who already has IBD, and the good bacteria are kind of at a loss, they are on a back foot, outnumbered by the criminal bacteria, overpowered by the bad pathogens, maybe there is a potentiation of the good bacteria inside. The good friends come in, it's like a new force coming into fight. So that sort of thing happens. But then, since the IBD has already happened, and as I mentioned that it happens years and decades before you get actual symptoms. So if you have been symptomatic for quite a while, that means the criminal or the bad bacteria have had their field for quite a while now, or for quite a long time. And a small dose of probiotics which you take, maybe a couple of powders a day, or maybe a couple of tablets a day, while these tablets also may contain millions and billions of bacteria. If you read the labels on those tablets or powders, you will find that yes, there are spores, or there are bacterial colony counts of millions or billions. Okay, but let me tell you, 1 gram of your stool will have 10 trillion bacteria. Okay, those can be good bacteria or bad bacteria. So if you have IBD, you for simplicity, let's assume you have 1 trillion bad bacteria in your stool. Okay, so, and they have outnumbered the good friends. So if you eat 1 billion, which is like 1,000th of a trillion, so you're eating 0.1% good bacteria twice a day. You do the math. Most of the people who are listening to this podcast, they are good at math, right? That's why they are listening to this podcast. So so with this, you do the math. This number is just not enough, and you will have to keep supplementing, and you will have to keep sending soldiers inside, maybe just to get overnumbered. I have to provide some potentiation in the form of immunosuppression or medical treatment for IBD, so that the inflammation goes down. And when the inflammation goes down, and when the leaky gut gets repaired, at least partially, if not completely, after that, it is only after that they find a healthy gut, they find a healthy house to live in, and the good bacteria can now come and overpower. But the healthy bacteria have taken years and years of your growth period, say maybe 10-20 years, to finally set up a colony and finally start helping you grow. So the good bacteria will also take their own sweet time to overcome and overpower the bad bacteria. So it's a very long process, and you will have to keep eating the probiotics. So they are not the only answer. Whether they are overhyped, I wouldn't say overhyped, but then yes, they have been commercialized and there has been a lot of push for using the probiotics, and it has led in scientific trials as well as in experiments, it has led to mixed results. Some doctors have been really happy with the results that the probiotics produced, but none of those doctors have tried probiotics alone. They have always tried it with medications. So you must continue your medical treatment of IBD, and with that you can have the probiotics. But why take the probiotics if you are anyways eating such small numbers of bacteria? Why spend on a probiotic where you can have it through a good bowl of curd? It's the same thing. Okay, so I always advise that in an acute attack, or maybe when you're having severe symptoms, you may benefit from a good dose of probiotics, but on the long run, it's always beneficial and it's always healthier to go back to the diet and eat a lot of curd, eat a lot of milk products, so that the good bacteria have the ground to grow again. So in summary, take the probiotics for a short term, find your cure, find the medicine that suits you, find the medicine that makes you healthy again, find the medicine that cures you, and then just switch back to the healthier diet. You may keep taking probiotics here and there in between with the advice of your doctor, but then that's not the only solution to your IBD.
Thank you so much for those wonderful words, because we always tell people that probiotics are not a solution in itself. They need the foods to support them, because bad bacteria are growing on something that is unfavorable. People are eating poor, they have poor food choices. That's why the bad bacteria are growing. When they just change their food choices, that is going to help bring back the probiotics in their life. And also fermented foods help with that. So that is the thing, that without the food, probiotics are not going to thrive. And I'm really happy that you gave this proportion idea where people can see for themselves, they can calculate what exactly probiotics might be doing and how they might not thrive. Talking about thriving, probiotics are just a small proportion, but there are more extreme treatments like FMT, fecal microbiome transplant. So what is your take on that? What kind of patients go through that, just briefly?
So a lot of patients come to me being treated for IBD elsewhere or in my own clinic, not responding to the conventional treatment. I have to upgrade and upscale the treatment every now and then. Maybe some of them suffer from the side effects of the treatment itself. Some of the drugs that I am forced to administer or forced to give for these patients for treating their IBD, they can cause many uncomfortable side effects actually. So these patients are not really happy with the side effects if they occur, and yet the disease is just running free, having a go at their gut. So they're kind of caught in a trap. So in such cases, because we know that it is the bad bacteria which are causing this damage, at least in part, if not completely. So what we try to do is we try to correct their gut environment with infusing them with a lot of good bacteria. So the probiotics that you mentioned, like the pills or the powders of good bacterial colonies, you can consume them. That's also a sort of mini FMT, or that's also a sort of mini microbial transplantation. These bacteria have been isolated from somebody else, and these bacteria maybe have been isolated from milk or curd, and these microbes are now being transplanted into you through tablets or through food. Even eating curd, a lot of curd is also you could say is a microbial transfer from outside to inside. Okay.
Yes.
Now you mentioned the word fecal microbiome transplant. That means when I see a diseased patient who is not really doing well with the medications and is suffering from the side effects of the medications as well, in addition to his or her IBD, and is doing poor, so I suggest to them you go for fecal microbiota transplant. So I advise to them, we will find a healthy donor for you. A healthy donor means a person who does not have IBD, who does not have any other health problems, most of his blood tests are reasonably well within normal limits. He is otherwise healthy for his age. His weight is okay, his BMI is okay, he does not have fatty liver and does not have many of the early diseases that we talk about, like cholesterol, blood pressure and sugars. So such young healthy persons who are doing well in their life, eating a healthy diet most importantly, and having a healthier part of the lifestyle, so such people are chosen, and you can obtain their stool. The stool is chemically processed. The waste is let to go away, but the most important part, the good bacteria from those stools, they can be isolated. So we create maybe a liquid or maybe a solid from those stools, whatever formulation is comfortable or whatever formulation is suitable. We do an endoscopy in the patients who are suffering from IBD. It's called a colonoscopy, and through this colonoscopy we inject this isolate of bacteria into the colons or the large intestine of IBD people. So patients with IBD, they undergo a colonoscopy, and this isolate of bacteria, which has been taken away from the stool sample, it is injected or it is introduced, and it is allowed to form a colony inside the unhealthy gut of the patient. And it is in the hope that these healthy bacteria from that healthy person, who were higher in number, more powerful, and they were doing a really good job for that person to grow, that person to do his digestion perfectly, and that person to function in his life perfectly, they will come to overpower these bad bacteria and maybe in some way halt the disease process, while the actual treatment of IBD also goes on. So both ways, you increase the bad bacteria and you also create a inhibitive environment for the bad bacteria through medical treatment. So both of these are combined, and it is in the hope that in the long run the person will start developing good bacteria in his gut and the disease process will slowly ebb away. It's a repetitive process. It has to be done in multiple sessions. Generally we do it over one session a couple of times, then let the patient go home, come back 2 or 3 weeks later, assess the disease activity again, how good he or she is doing with his disease, and then again inject them with another stool isolate. So those, in this way, multiple times we have to infuse bacteria. The advantage over eating a pill of probiotics is that we can infuse a larger isolate. So we can actually infuse billions and trillions of bacteria. So because it has been isolated from stool, as I told you, 1 gram of stool will have trillions of bacteria, and a healthy person will have good bacteria. All those trillion bacteria, almost all of them are good bacteria. So now you're getting, instead of a small pill, which is kind of a lone warrior in front of trillions of bad soldiers who are sitting inside you with IBD, you now get a huge army of good bacteria being transplanted inside you repeatedly over a few sessions. And over those sessions, as the weeks and months pass, I can see the progress of IBD. And to tell you the fact, there have been positive results. So IBD, which has been difficult to treat with medications or was requiring multiple medications, such patients have been treated successfully. Actually, the first experiment that happened in 1989, if I'm not wrong,
Yes.
There was only one patient who was about to go for surgery, was desperately, as a last ditch stand, was treated, and then he remained well for 20 years without surgery.
Yes.
So it was the first story, but since it was a single person story and could have been a coincidence, so people have tested these treatments of isolating bacteria from healthy people and infusing them in large numbers into diseased patients, and it has worked wonders in at least a significant proportion of patients, if not majority. So if you have IBD and if the usual treatments are not working, or you are being forced to continue the treatment for a very long time, then you could go for FMT, you could go for microbiota transplantation, and you can hope for a beautiful result and an improved quality of life over a long term. It's a long process. It may have to be repeated again and again, but yes, I think it certainly potentiates the standard treatment if it cannot replace it.
Thank you so much for the deep insights on FMT. And this pioneering experiment was done in 1989 by Dr. Borodi in Australia. He currently resides in Sydney. And this was an amazing experiment that transformed how we think about health and disease and how treatment actually is done for critical cases like this that do not respond to any other treatment. Because here we are talking about not just transferring a few billion microbes that are maybe one strain, two strains, or 20 different kinds of bacteria. When we are talking about commercial probiotics, here we are talking about transplanting thousands of different strains. And the entire community in itself is working symbiotically within itself. And then this entire thing is established, the colony establishes, and that takes it to a different level. I always like to say that one man's waste is another man's treasure. So it might sound very gross or weird to many people, but it is so valuable. And the problem that because majority of us are so unhealthy, it is very, very difficult to find young, healthy donors. So
Yeah,
that is something.
rarity in these days. But fortunately, generally we get some good vegetarian, healthier, exercising, self-aware people. So and testing them actually reveals positive findings about good bacteria. So they are able to donate. So and since it is absolutely no harm donating your stool. If you are healthy, if you are absolutely devoid of any symptoms or any disease, your blood reports are normal, you do not have any liver disease or fatty liver, or do not have any kinds of those early comorbidities like blood pressure or cholesterol, you are exercising reasonably frequently, then it is a very good chance that your bacteria may be on the healthier side, and donating those bacteria could actually improve somebody's life to a great extent, and it's absolutely no harm to you.
Thank you so much for all of these wonderful insights about IBD, what happens, and what are the kind of treatment methods that you use very commonly. It is discussions like this which enrich us, which give us even more insights to lead a very, very healthy life. So I would like to ask you for just maybe a few final thoughts, maybe 5 tips that people can use in their daily lives to prevent diseases like this.
So to prevent diseases, I will just kind of summarize what we talked about. So it all begins as a very slow process, and it's almost invisible to you if it's happening so slowly over the years or decades. So you begin as a small child or a baby, eating healthy, growing up in the family, well protected, being provided healthier, well cooked, fresh food every time, twice or thrice a day. There comes healthy breakfast, there come a lot of fruit which parents bring to you, there come a lot of a lot of variety of vegetables and variety of bread and the rice preparations that happen in a typical Indian home, and there are tastiest of spices and condiments that we use in our food, which really provide a nice flavor, fragrance, and aroma to the kitchen and the dish that gets served in front of you, hot and fresh. So you have grown having this luxurious experience, but then you start turning 10 or 15, go into your teens, and you start getting attracted by those outside commercials and by those outlets, the quick service restaurants and everything, who now actually serve you processed, canned, preserved, and stale, to be really honest about it, and dead frank about it, that they're serving you stale food. So, and it is most often non-vegetarian, because that is the cool thing these days. They serve you non-vegetarian foods, which really is not something our body is made to digest. Otherwise, we would also have been running around in jungles hunting deer. But that is not who we are. We are a human being, and we are all made to digest plants or plant products the best. So that is why those foods which are fried, deep fried, air fried, or vacuum fried, I don't care, any kind of fried foods in excess, of course, We also eat fried foods at home, but it's in a significant minority. So all those fried foods, if they are consumed in excess over the years, which especially begins in your teens as a fad and then becomes a fashion, so all of those things will start altering the friendly bacteria or the friendly people sitting inside your gut and waiting to digest some of your nutrients while growing themselves and while making you grow into a healthier person. These bacteria now start getting overpowered and outnumbered by the bad bacteria, and the population and the dynamics within the gut keep changing. And now the colony is a mixed race of good and bad people inside you, and some of them are willing and kind of fighting to harm your gut, while some of them are fighting tooth and nail to protect you from those bad criminals. But since no symptoms are being produced till you're 2025, most of the people end up coming to my clinic and say, okay, I eat late, I sleep late, but I wake up very late, I don't exercise, I eat whatever I want whenever I want, and I just love eating outside. I've been doing this for the last 5 to 6 years, ever since I stepped out of the house for my career, for my job, or for my studies, and nothing ever happens to me because I am so healthy. That's because those symptoms have not been produced yet. And somewhere at the end of the line, these people, some of them come at 20s, some of them come at 30s, but almost all of them land up in front of a doctor in a gastro clinic or maybe a physician's clinic, complaining about their tummy. Sooner or later, the people who had a good healthy habit of exercising before they defaulted, they present later because they have a healthier gut on the background, which takes longer to damage. Some people who never had the habit of exercising, always were in front of a computer or a chair studying very hard for their careers and their goals, those people will already have an unhealthy environment, and then they get brilliant jobs and nice careers which involves more sitting and more hard work and more unhealthy and stressed lifestyle, and that is what leads to many of the diseases, one of which is IBD. So it is said in our own Ayurvedic system of medicine that every disease begins from the gut or every disease begins from the stomach. So in some ways it is actually true, because now because our research in Western medicine about every single disease, be it a neurological disease, be it a skin disease, or be it a gut related disease, it has reached a molecular level, and we are now finding literally atoms and molecules which are going wrong in our body to locate the source of disease and to locate the singular cause of the disease. All of these are pointing out that yes, there are chemicals and there are hormones and there are some transmitter chemicals released by these own bacteria, which are responsible for either the good condition or the bad condition, the good outcome of the disease or a bad outcome of the disease. So all of these are being produced by the gut bacteria, and it all depends on whether the gut bacteria at the baseline or in the background are healthy or they are bad bacteria. So if you have a healthier population of bacteria to defend you, you may do well even if you develop a disease. If you already have a damaged bacterial microbiome or already have a damaged gut environment, then you may respond badly to treatments also, and you may develop further diseases. So the key is to maintain a very healthy diet, and over and above a very healthy lifestyle. Wake up early, sleep early, exercise regularly, eat well, eat on time, and keep the level of stress as a part of the life and keep the level of stress at a bay, because everybody is stressed, including doctors who are fighting for the lives of patients. But then that doesn't mean that they sacrifice their own health, or it doesn't mean that you sacrifice your health for an overseas company just because they are asking you to work overnight. Okay, so keep yourself healthy, keep your gut healthy, and I think you will go a long way.
Thank you so much, Dr. Akshay. This was powerful. There are so many takeaways for the viewers. Thank you so much for enriching everybody's lives with these wonderful insights. Thank you so much.
Thank you. Thank you so much.
So viewers, I really enjoyed this podcast. I enjoyed getting all of these insights, and this is going to help me choose much better things to make my life healthier. What are we living for? Are we living for a bank balance that we see online, that this is the money that we have? Are we living to enjoy, be disease free, be free to do whatever we want? And the solutions are extremely simple, as Dr. Akshay said: reduce stress, eat a balanced diet, have a stress free life, do some exercise. These are very, very basic things that we can all do. If we think about even the most extreme of treatments, which is fecal microbiome transplant, we do not have enough healthy donors. So where do you think India is going? Where do you think the world is going? So it's time we wake up and start going back to our roots, where we focus on who we are, because this is the life that we are living. We need to make it disease free, we need to make it enjoyable. So stay tuned for more such podcasts. Thank you so much for joining.